I thought we'd just go through as a group what you guys see as the most common causes of hearing loss. Just when the patients walk in, what do they complain of? Kristen.
My patients tend to complain that it's the clarity, that they heard you, just not really sure what you said. I caught that, but can you repeat that again? Not really sure in terms of the last word or kind of what you asked of me. Clarity tends to be the biggest issue.
Yeah, I think for me, a lot of patients that I see, they complain of ringing in the ears. So whether that's a ringing noise, a buzzing, a whooshing, that's a very common complaint that I see, which is a sign of hearing loss.
So patients who come in with ringing or problems with clarity, they probably should have a hearing test.
Definitely.
I see mostly, especially in the elderly, I will see patients who come in who have difficulty understanding and hearing people when there's a lot of extra background noise. So if they're at a party, they're at an auditorium, maybe the TV's on, the fan's on, the dog's barking, grandkids are running around, and they just can't participate in the conversation. So that seems to be a pretty common reason. I think people also that have dizziness probably should come in and have a hearing test because there's a lot of correlation with dizzy patients who also have a hearing loss, ringing patients who also have a hearing loss. With children, you tend to see the kids who have some speech delay depending on their age, and I think that can be really important. So any child who has a speech delay, a learning disability, any concerns from the parent that there's a hearing loss, we should have them checked too.
Yeah, want to make sure it's not a hearing loss that's causing their speech delay. That can make speech therapy much more difficult for the child. If it's related to a hearing loss, their therapy is going to be different than if it's just an articulation problem.
Right. Another thing that could be really important is if there's a hearing loss on one side or ringing on one side, because one-sidedness can point to something a little more dangerous. So they definitely should come in to have us look at it.
I agree.
The sudden aspect of hearing loss too. If it just happened, if yesterday you were hearing fine, this morning you wake up and all of a sudden you can't hear, definitely getting a hearing test right away is going to be important.